I wanted to ask, what have you implemented in pedo practices that keeps the hygiene department full and productive?
Verbiage. Verbiage is everything. A lot of times you'll see front desk or clinical. They'll say, hey, you know what, Sally really needs to come back for their next appointment. You go ahead and give us a call when they're ready for their 6-month recall and their sealants. Implementing the verbiage of the power of suggestion, which is a really big thing that we talk and we coach with our teams, is we need to go ahead and get JoJo scheduled for his next appointment. We know school, he's going to be in school, this, that, and the other thing. So definitely verbiage, power of suggestion. That's going to help mom and dad or guardians feel more accountable. They know that the office gets booked up. We need to go ahead and get him on there so we can get his, teeth maintained. That sort of thing is huge.
Mm.
Yeah. And I think about it too, right? As a hygienist myself, one of the things that was really interesting was I could get them to schedule when they were in the chair with me. So when the family was with me and I'm talking about it and I'm sharing, and I'll be like, hey, little Timmy's appointment today was great. Look at how far he has come. He used to go to the dentist. He's excited and happy right now. Ask me for strawberry. Mom, it's really important that we keep this up. And I want to make sure that, we are checking on those 6 months, the 6-year-old teeth coming in the back. I want to see how they're coming in. Let's go ahead and schedule that appointment now because we will get full, especially because it's going to be really crazy. So let's get scheduled. So what I thought was really powerful was I know that hygienists, they don't want to do more work than just doing the hygiene. But the reality is, for me, it was very successful to get them scheduled while they were in the chair with me, because I didn't have to worry about, while little Timmy is picking out his prize from the prize box, I'm talking to mom and dad and having them scheduled already. And now then, if I have the time, to be honest with you, and again, this was a very busy practice. I was seeing patients every 30 to 45 minutes, very, very busy practice. But what I loved about it was if I did have a time, or if it was something where my next patient was running or something late like that, I would walk them to the front desk, or I would walk them to the exam where the doctor is too. And I would put down, and if I walk them, we're like, hey, make sure that they're scheduled for the sealants, and it always helped. And what also was interesting was the parents felt way more connected to me because I did care, right? And if they will say, yeah, he's practicing or she's practicing, she has a ballet recital coming up, like, great, okay, she wants a ballet recital coming, did you want to get her cleaning done before that? What did you want to do? And they're like, this is so great because you are communicating with me as a human and not just as a, let's get you scheduled because you are going to have to come back in 6 months, right? And have you found that to be successful where the hygiene department schedules compared to the front desk for the 6-month recare?
Absolutely. That always works. Hands down, that absolutely always works. And like you said, Manal, it helps the parent feel directly connected to you as the provider, which is super important. They feel like they're a part of their children's health. They know what's going on. There isn't that missing connection. We have a lot of times, we call it the 2-on-1 transfer, where, like you said, the hygienist, the assistant will go ahead and bring the patient up to the front desk. And it just reiterates everything. And it's amazing how that small gesture of reiterating the verbiage, all the things that are entailed, it makes the patient and the parents feel completely connected to what's going on and a connected relationship with the practice.
And at the end of the day, that's what they want, right? I mean, this is a pediatric practice. They want to make sure that their kids are going to a practice that is kind, and the team there cares about what's going on and is involved.